As time has told us, once one drug starts to leave the supply, there usually is a more deadlier one to follow. Have we learned anything from history, people? Many of you have probably heard of Xylazine, and then you may have heard the term synthetic opioids. One of the biggest issues is when it comes to these newer drugs that are being put in the supply, they don't respond that well to Narcan. Now, you're still going to use Narcan, but the response you normally would get from Narcan, pretty immediate. You're not going to see, especially if tranq is involved, or another sedative known as medetomidine. In places like Philadelphia, one of the things I learned was that these outreach programs, they're working with labs and they're actually testing the drug supply so that they can stay on top of what our loved ones are putting in them. And while we're still talking about fentanyl, what you may not realize, fentanyl isn't really the biggest concern in the Kensington area, Philadelphia area. It's xylazine and medetomidine. So xylazine is the one you've probably heard people talk about, also known as tranq. Medetomidine is another animal sedative. Both of these are leading to their own overdoses. People think that they're using fentanyl. That's what they're trying to get. But what they're getting is fentanyl that's maybe cut heavily with an animal sedative, such as medetomidine or xylazine. So Narcan only reverses opioids. So when you give someone who has tranq involved or medetomidine, that it's gonna lift them out of the fentanyl piece, the nitazene piece, since those are a form of an opioid, but it's not gonna have any effect on the sedatives that are being cut in the supply. So what happens is when you go and you administer naloxone, you're going to see that they're still gonna appear heavily sedated. When I had the opportunity to go up to the Kensington area and talk to the people who are on the ground actually helping the individuals in these communities that are struggling, one of the issues they're seeing, obviously, is that they're not responding to naloxone. One of the things I know is particularly with medetomidine is it causes severe bradycardia and low blood pressure. The effects of these sedatives in the drug supply, it can last for hours. So if they don't respond, it doesn't mean that the Narcan failed. It just means there's something else on board that isn't going to respond to that antagonist. You're still going to give Narcan. You're going to monitor their respirations and make sure that they're continuing to breathe enough, and you may have to assist those breaths. So it is crucial in these situations. EMS is called. In the bigger hospitals, a lot of their protocols include administering clonidine to help with the withdrawal symptoms as they're coming off the medications, and even ketamine. If you love someone who is using opioids right now, you need to hear this, because the key takeaways are you're still gonna give Narcan. I can't say that enough. Always give Narcan first, and then you're going to focus on their breathing and may need to administer rescue breaths. And then you're going to call 911. You're going to get EMS there so that they can help get them the appropriate care that they need. And remember, the supply is always changing. Stay informed. If you like this type of content and you want me to start educating you guys on more things that are making the news, that they're seeing in the drug supply in different areas of the country, please drop it in the comments. Let me know. like, share it with somebody who would benefit from this. And as always, be safe and do what you can live with.